Hi everyone, my name is Dr. Inaka Yembe. You know, in the battle of the bulge, belly fat is an extremely tough opponent. So I decided to put together this series of 3 videos just talking about different things that we can do to banish belly fat. There are actually some foods that are fantastic for your taste buds and great for your waistline as well. And there are also some exercises that I believe will give you the most bang for your buck when it comes to combating belly fat. You know, how strongly defined your waistline is so much really about the muscles that you have, but it also depends on the amount of belly fat that you have. Now, we're talking about belly fat because abdominal or visceral fat, and that's the fat that you cannot pinch between your fingers, that's what's really most dangerous for our health. You know, the studies show that your abdominal waistline, the distance of your waistline or the size of your waistline is very important because it puts you at risk factor for some diseases like heart disease, diabetes, and hypertension. So it's very important for you, not only for aesthetics, but for your health to really work on eliminating belly fat or reducing belly fat because of this visceral fat that takes up residence in your internal organs, and that's linked with heart disease, diabetes, metabolic syndrome, and even some cancers in women. So since it's nearly impossible to tell how much visceral fat we actually have, scientists have figured out a couple of guidelines for you in order to decrease your incidence or the risk factor for developing these major medical problems. You can simply measure your waistline, and that magic number for women is 35 inches. Your waistline should be less than 35 inches in order to reduce your risk of heart disease. For men, that is 40 inches. So in my next 3 videos, we'll look in depth into what we can do to eliminate belly fat. In the first video, we'll simply talk about the anatomy of the abdominal wall muscles. In the second video, we'll talk about what to eat and what not to eat. And then in my third video, we'll talk about some exercises that worked best for me and how I was able to reduce my waistline from 30 inches to 28 inches in 30 days. So let's get straight to the anatomy of the abdominal wall muscles. It's important to know them because when you know them, you can really understand how to work them in ways that are most effective for you. Now, the abdominal muscle encloses the abdominal cavity, and it can be divided into the anterior, that's in front, and the lateral, that's on the sides. It can be divided into the anterior lateral sections and into the posterior sections. Now, for abdominal wall muscles, for the purposes of this video, we'll be talking only about the anterolateral, so that's the front side of your sections, of your midriff. The back is just simply your back muscles. We're not talking about that. Now, the abdominal wall forms a firm but flexible boundary which keeps the internal organs known as the abdominal viscera. It keeps them in place and it maintains their anatomic position against the force of gravity. It protects you from injury, and it also helps with your breathing. Let's say you take a deep breath, blow it out. So with forceful expiration, you're really using your abdominal wall muscles. It's involved in some actions like coughing, vomiting, having bowel movement, because those abdominal wall muscles contract and increase your intra-abdominal pressure to help with those actions. The anterolateral abdominal wall muscles consist of 4 main layers that go from external, so outside, to internal, and they are called the superficial layer, really, which is just your skin, the superficial fascia, which is underneath your skin, Then you have the muscles, which we would really be talking about at this time, and their fascia. And then you've got the parietal peritoneum, which is just a cover on the inside of your abdominal wall lining before your internal organs. Now we are looking just at the anterolateral abdominal wall muscles, and I'll tell you some of their functions as we go along. The muscles of the abdominal wall can be divided into two main groups. Some of them are flat and some of them are vertical, so going from top up to down. Now, the three flat muscles that we'll talk about are located laterally. That is, they are stacked on each side of your belly, one on top of the other. Their fibers run in different directions and they cross each other, and that's what really strengthens your abdominal wall muscle. So number one, we'll talk about the external obliques. This is the largest and the most superficial muscle of the abdominal wall. It runs from the ribs, so that's rib number 5 to number 12, and it inserts into your hip. They function in contralateral rotation of your torso, and that's the external obliques. These are what you feel on the outside from rib number 5 to 12, and they insert into your hip, and so they run from top to down. Now the internal obliques are just on the inside of the external obliques. These are the same, they are thinner, and they run superior medially, perpendicular to the fibers of the external oblique, so superior and medially. Where they attach from is, they will run actually from your iliac crest and they go up into ribs number 10 to 12. So they are going from down to up. The external obliques go from up to down. Their function is contraction and compressing the abdomen while your torso is rotating. There are two vertical muscles also in the middle. So we've talked about the external and internal obliques on the outside, and in the middle on the inside, we have the two more muscles which are more vertical muscles. The first one is the rectus abdominis. Rectus abdominis, and that's the most common six-pack. When you see someone standing and you can see the muscles, that really is what we think of as the abs, and that's the six-pack muscle here. Now, the rectus abdominis muscle, which is, like I said, is the six-pack, they come together in the midline going from top to bottom, and they come together with one, they are split into two by what we call the linea alba, that linea alba. Sometimes when you get pregnant and your abdominal wall stretches, sometimes this linea alba can separate. Now, in several places, the muscle is also intersected by some fibrous strips known as the tendinous intersections. Now, that's what gives you your six-pack right there. Now, they originate from the iliac crest, so from the top of your pubic bone, and they go up into the bottom of your sternum called the xiphoid process. Now, the function of that muscle really is to help compress the internal, they really keep your internal organs of your abdomen in check, and they also stabilize your pelvis while you're walking. Now, the pyramidalis, I can say that pyramidalis is really a small triangular muscle. It is formed that is on top superficially to the rectus abdominis muscles and is located inferiorly with its base in the pubic bone. It goes actually from the pubic crest and the pubic symphysis before inserting into the linea alba. So it just really acts there to tense up the linea alba, and that's really it. Now, the deepest muscle that we have, and this is the muscle that I talk about. If you've heard me talking about ab vacuums, that's the muscle that I'm talking about contracting. This is the transversus abdominis. It is the deepest abdominal wall muscle which wraps around the waist to support the spine. That transversus abdominis, that now it's attached from the inguinal ligament to the costal cartilages, which go from rib number 7 to 12. And its own function really is to compress or keep in check the abdominal contents. So that's really, in a nutshell, what the abdominal muscles are about. In video number 3, we talk about working out your lower abdominal muscles and your upper abdominal muscles. Now, what really determines the visibility of your ab muscles? Imagine if your ab muscles are like the meat in the middle of a fat sandwich. Your ab muscles are just in the middle. You have your superficial fascia, which is just underneath your skin, and then you have the fat that's underneath your muscles. And so the muscle is just like a sandwich between two layers of fat. So what you can pinch with your fingers really depends on your body composition. Below them, however, is the visceral fat that you cannot pinch. That's the most dangerous one, and that's the kind of fat that also takes residence inside of your internal organs. So it's important for you to understand that for your abdominal wall muscles to be really visible, yes, it's good to work them and do different exercises to tone them, but for them, those muscles to be visible, you really also want to work on your total body fat as well. So I hope this information has helped you, just give you some insight on the abdominal wall muscles and their anatomy. In the next video, we'll cover what to eat, what not to eat, that will help you lose fat overall, especially the things that would prevent you from gaining fat around your abdominal wall. I hope this video really helps you and it has been informative for you. If you have a comment or a question, or you want me to touch on certain things, please post them in the comment section as well. And I hope that you have more insight on what muscles you're working when it comes to working your abdominal wall muscles. Thank you. Hey, if you haven't joined my channel yet, or if you haven't followed my program yet, just head over to my website at drinakayembe.com. There is a 30-day Banish belly fat challenge on there that may help you. I hope you enjoyed this video enough to like and subscribe my YouTube channel, and don't forget to follow me on Instagram and Facebook, and I would follow you and I would come back next week and share more information on what to eat and what not to eat in order to help you banish belly fat. Thank you, and I'll talk to you.